Welcome to Big Brothers Big Sisters of Washtenaw County. We are so glad that you've taken the steps to enroll your child in our program. This short presentation will help you understand who we are as an organization and how we support children in our community. Big Brothers Big Sisters of America is the oldest, largest, and most effective youth mentoring organization in the United States. Big Brothers Big Sisters of Washtenaw County is now over 25 years old. We are excited to get to know you and your child and to be a part of their lives as they learn and grow. Today we will give you a brief overview of Big Brothers Big Sisters, or BBBS for short. We will also talk about the impact that BBBS programs have on kids and how we track that progress. From there, we will talk about what a developmental relationship is, how that looks within a match, and what each participant's role is within that relationship. Our top priority at BBBS is child safety, and we will take some time to talk about child safety and the risk and protective factor survey you will take. We will end today with an overview of the process moving forward. We work with parents, guardians, volunteers, and others in the community and hold ourselves accountable for each child in our program achieving higher aspirations, avoiding risky behaviors, and achieving success. When your child ends an outing with their big and feels good about themselves, that will translate into every aspect of their life. Kids who are more confident are more likely to ask questions to adults when they have them. They are more likely to have stronger friendships and make good decisions. And that is what we do at BBBS. Help kids achieve success through professionally supported one-to-one mentoring relationships. Big Brothers Big Sisters is committing to respecting the diversity of all that live in our community. We do not discriminate against any person that enrolls as a big or a little in our program. We give everyone the opportunity to enroll to determine their best fit within the organization. We will match your child with a big based on all that we learned from you, your family, and what you're looking for in a match. We will learn a great deal about you and your family through the enrollment, matching, and match support process. We commit to keeping that information confidential. People that may see your files are BBBS staff and interns, a BBBS office volunteer that may assist in finishing files or making information telephone calls. All volunteers are screened and sign a confidentiality policy, which is on file in our office. Big Brothers Big Sisters of America does an audit of a percentage of the files to ensure that all policies and procedures are executed properly. Closed records are kept by the agency for a minimum of 5 years after the case is closed. At the end of 5 years, volunteers and children that were never matched will be shredded. Files for those that were matched will be placed in agency archives. Big Brothers Big Sisters is a unique program and is different than other youth development programs. At Big Brothers Big Sisters, we focus on the one-to-one relationship development and match children with adult mentors who provide support and guidance. Every match in our program is guaranteed to spend consistent time together. Matches will spend one-on-one time together at least 2 times per month for the minimum commitment of 1 year. We really take the time to get to know you, your child, and our volunteers in the enrollment process. When we are matching bigs and littles, we look for traits that will help make for a strong and healthy relationship. We want to ensure that the big and your child share common interests, have similar expectations for the match, and maybe even share life experiences. Due to this, the waiting period can vary from child to child as we wait to find a volunteer that best suits your child. We want to take time to assure you that BBBS support is ongoing. We know that we cannot address every aspect of the match before you meet your child's big. You will be assigned to a mentoring specialist who can help troubleshoot if anything comes up. They will also assist in those early stages of relationship development and help the match get to know each other. The agency can also provide access to resources for both you and your child if needed. You might be wondering, how do mentoring relationships impact children? Well, we track the impact through surveys that children in our program take. These surveys measure a little's attitude on self-confidence, academic achievement, and on peer pressure. All littles take a youth outcome survey before meeting their big, and then again after being matched for a year. We found that when retaking the survey, 96% of those answers stayed the same or improved. And that's how we know what we are doing is working. In addition to the youth outcome survey, we also have our littles take a strength of relationship survey, which will measure how the relationship is developing and ensure our matches are on track. Your child and their big will take this survey at the 3-month and 1-year mark of being matched to track their progress. In our organization, we strive to ensure that our matches are building relationships according to the developmental relationship model. A developmental relationship involves a dynamic mix of 5 elements, including expressing care, challenging growth, providing support, sharing power, and expanding possibilities. Each of these elements is expressed through different actions, and throughout the course of your child's match, we hope that these are at the core of the match relationship. Research has shown that developmental relationships are especially helpful for our young people today. The studies have shown that young people who experience strong developmental relationships are more likely to report a wide range of social emotional strengths and other indicators of well-being and thriving. Young people with strong relationships are more resilient in the face of stress and trauma. Young people also do better when they experience a strong web of relationships with many people. Again, here at Big Brothers Big Sisters, we hope that the children in our program will see increases in competence, academic success, and an avoidance of risky behaviors. It is our hope that by promoting a developmental relationship within the match, it will empower your child to continue to make good choices in their adolescence. In order for your child's match to be successful, your role is to be an active partner within the match. You will help find the best times for outings to occur and make sure that your child is prepared for each outing. If the plan for the outing does not include food, be sure that your child has eaten or is bringing a snack. Help make sure your child is ready, on time, and dressed appropriately for whatever activities the match is doing. We also encourage you to know details of each planned activity and to make a point of being home or informing the big of who will be home when they return your child back after outings. Don't be afraid to share your concerns, your hopes, and your wishes for your child with your BBBS mentoring specialist. You could also talk to your child's big about the things you expect within the match. Remember that the big brother or big sister is a volunteer, but they are a part of this program because they want to be. Our volunteers share how much they appreciate feedback about how their littles are doing and enjoying the match. Although life can get busy at times, it is important to prioritize returning phone calls and staying in regular contact with your child's big. Regular contact is important to the success of the match, but remember to give it time. On average, it takes about 3 months for the relationship to really blossom. During the first year, match support with your Big Brothers Big Sisters mentoring specialist is required for both you and your child. Your mentoring specialist will work with you to schedule these monthly check-ins and find a time that works so you can share the match's progress. These support calls are also how we help to ensure child safety and are mandatory for participation in the program. Your child has an important role to play within the match as well, as this is all about them. Most importantly, we want for your child to have fun and simply enjoy being a kid when they're with their big. It's also important for them to be willing to grow and try new things or go new places. This match is for them, and we want them to be willing to suggest ideas for outings too. We want your child to share their hopes for what they want to do with their big and what goals they want to work towards. We hope that they will share with their big when they are having fun and remember to say thank you to their big on occasion. Most importantly, we don't want your child to keep any secrets about their match from you or their mentoring specialist. That brings us to talking about the role of a big. Their main role is to be a friend to your child and have fun. A big is a positive role model who will spend quality time with your child, doing fun activities and providing support to them. Bigs can be partners in problem solving. They can help their littles learn new coping strategies and understand the importance of setting boundaries. Overall, bigs are here to be a friend that can help empower your child to be whatever version of themselves they want to be. Next, we are going to spend some time talking about a study done by the Center for Disease Control that looked at the impact of childhood experiences on health. The study found that childhood experiences, both positive and negative, have a tremendous impact on long-term health outcomes. They looked closely at what they call adverse childhood experiences, or ACEs. They found that ACEs are common. Nearly 2/3 of adults have at least one. ACEs are childhood traumas that result in toxic stress that can harm a child's brain. This stress may prevent a child from learning, from playing in a healthy way with other children, and can result in long-term health problems. ACEs are listed on the screen, some being emotional abuse, physical abuse, household substance use or violence, bullying, experiencing discrimination, and homelessness. While this information may seem overwhelming, there is hope, a lot of hope for the future of children in our community. Together with resources and knowledge about protective factors like resiliency, we have a lot of tools to help today's young folks have a brighter future. We will talk next about one of our greatest tools to help children through life's challenges, resilience. What is resilience? Resilience is the ability to return to being healthy and hopeful after bad things happen. Research shows that if a parent provides a safe environment for their child and teaches them how to be resilient, that helps reduce the effect of ACEs. Resiliency trumps ACEs and helps children avoid negative health risks. Parents, teachers, and caregivers can help children by helping them identify feelings and manage emotions. They can also create safe physical and emotional environments at home, in school, and in neighborhoods. What does resiliency look like? For us here at Big Brothers Big Sisters, it is building social and emotional skills, helping children interact in a healthy way with others, manage their emotions, and communicate their feelings and needs. We know that one of the key strategies to building resilience in children is having at least one stable, caring, and supportive relationship with an adult in their community, such as a teacher, coach, healthcare provider, and our bigs. One way we get to know children in our program is through a risk and protective factor inventory. Risk factors are characteristics of the youth and/or his or her surroundings that increase the likelihood of negative outcomes, such as the various ACEs we spoke about earlier. While protective factors are those things that reduce the impact of risk on positive youth outcomes. We hope to provide opportunities for the youth in our program to build their resiliency skills, and in order for us to do that, we need to have a solid understanding of what each child is bringing with them in our program. We ask parents to fill out a risk and protective inventory for each child that they enroll into the program. Each child is different, and we strive to be able to provide the most individualized supports by recognizing the strengths each child will bring to the match, as well as the areas he or she could use support in developing. We also use this information to find the best big for your child and develop goals for the match to work towards. Child safety is the number one priority at Big Brothers Big Sisters, and we have already spent some time reviewing risk and protective factors. We will next talk further about child safety at Big Brothers Big Sisters. BBBS staff and interns are advocates for child safety and are mandated reporters. It is our belief that open communication, education, and adding another caring adult into a child's life are 3 strong preventative measures. We hope that parents take the time to talk to your children about safety, keeping their bodies safe, safe use of the internet, community or neighborhood, and gun safety. We do cover these topics age appropriately in our orientation with children and ask them to sign a safety pledge. BBBS has an established set of program policies and procedures for volunteer and family enrollment and program rules that are guidelines to keep kids safe in their match relationship. We will go over these with you, as well as your child and the volunteer, at your orientation interview, as well as at your match introduction meeting. At Big Brothers Big Sisters, we take child safety very seriously. And while working with kids, we cannot ignore that child abuse happens. At BBBS, we understand that child abuse can happen in any situation where an adult has power over a child. This could include a doctor-child relationship, parent-child relationship, coach-child relationship, or even mentor-child relationships. There are 4 types of abuse that exist. Emotional abuse happens when the adult in power deliberately makes the child feel bad about themselves or uses guilt or gaslighting tactics to get the child to respond differently. For example, direct insults to the child, withholding affection or attention as discipline, swearing and using inappropriate language to a child, or public humiliation. Refusal to change this behavior, even after it is addressed, is a clear sign of emotional abuse. Physical abuse happens when an adult inflicts physical pain to a child, which can cause scarring, bruising, or burning. For example, hitting, punching, kicking, choking, or slapping, or using weapons as a threat or to inflict harm or pain. Sexual abuse is very serious and can be the easiest form of abuse to hide. This happens when an adult inflicts any type of sexual activity onto a child. For example, exposure to pornography or nudity, inappropriate touching, and rape. Neglect happens in situations where families have the resources to provide their children with their basic needs, but willingly refuse to provide the child with those things. This could look like refusal to seek medical care when a child is sick, withholding food for punishment, or neglecting their educational needs. It is our job as staff at Big Brothers Big Sisters to ensure that our children are safe when they are with their bigs, as well as do our best to ensure that children are safe in all other aspects of their lives. We can be the strongest defenders of child safety with you as our partners. Let's take the time to review some of the safety concerns that exist in the everyday lives of our children. Please know that if your child has been affected by any of these safety risks, Big Brothers Big Sisters staff can help you navigate how to talk about these issues and share ideas and ways we can work as a team to support your child. Unfortunately, many children that attend school in the United States have either witnessed bullying or have been bullied themselves. Children with a lack of support and outlets for emotions may become bullies themselves. With the rise of the internet and social media, bullying is a serious issue for today's youth. We also know that unfortunately gangs exist in our community and can be sought out by youth to feel a sense of community. This can lead to additional safety concerns, negative peer pressure, and possible exposure to community violence. Self-harm and suicide are very serious safety concerns and should never be taken lightly. Whether it is your child who is facing these issues or a family member, let them know that they are not alone. If your child is ever experiencing shifts in their mental health or contemplating suicide, do not brush it off. Let a medical care provider and the Big Brothers Big Sisters staff know immediately. We can work with you to connect you to resources and educational opportunities to help provide your family support. Match support is a mandatory aspect of our program and it helps us ensure child safety. Each month, we will talk to you or your child, as well as their big, to check in and make sure that policies and procedures are being followed, that your child is safe, and that your child is enjoying their match. Your match support specialist is there to give activity ideas, provide feedback on the relationship, help bigs know that they're making a difference, provide you access to resources or support if you need them, help the big and the parent work together, mitigate or navigate any issues that might arise, and provide a personal connection to the Big Brothers Big Sisters family. You have already completed your application and are now watching our orientation video. We will next schedule a time to interview you and your child. Once we finish the interview process, your child's file will be reviewed and then accepted or referred for other services. Due to the volume of children we serve, there is a wait list. For little brothers waiting for a big brother, the average wait list is about a year. If you or your son are open to a big sister and they are 11 years of age or under, let us know, and this may shorten their waiting time. For little sisters, the average wait length is just a couple of months. Once we have found a suitable and well-matched volunteer, we will contact you to share some non-identifying information about the potential big. If you feel that it sounds like a good match for your child, we will schedule what we call a match introduction meeting, which will take place in your home with a Big Brothers Big Sisters staff or intern, the potential big, yourself, and your child. We want to thank you for taking time today to learn more about Big Brothers Big Sisters. You are one step closer to having your child matched with one of our great bigs. Please click the link to fill out a form of completion. You will be contacted by one of our staff to schedule your interview, but please feel free to reach out to us to discuss any questions or concerns. We look forward to getting to know you and your family more during the interview.